For decades, public health experts have known that syringe exchange programs reduce the spread of certain viral infections like HIV, hepatitis B, and hepatitis C by removing contaminated syringes from circulation. They've known that programs using sterile injection equipment are both safe and save money, and yet they're rarely seen in the United States. Why? How? That's the topic of this week's Healthcare Triage. Special thanks to my colleague Austin Fracht, whose Upshot column formed the basis for this episode. Evidence abounds that needle exchange programs work. A study of the first American program in Tacoma, Washington in 1988 found that use of the exchange was associated with a greater than 60% reduction in the risk of contracting hepatitis B or C. Another study of over 1,600 injection drug users in New York found that those who didn't use a syringe exchange in the early 1990s were more than 3 times as likely to contract HIV. Syringe exchange programs do more than improve health. Because they're so effective and far cheaper than the lifetime cost of treating HIV or a hepatitis, they save taxpayers money. A cost-effectiveness analysis published in 2014 replicated the findings of others that came before it. $1 invested in syringe exchange programs saves at least $6 in avoided costs associated with HIV alone. The most frequently expressed concerns about the programs are that they promote drug use and raise crime levels. But according to many studies, that ain't so. Instead, they're associated with increased participation in treatment programs. Michael Botticelli, director of the Federal Office of National Drug Control Policy, said at an event sponsored by the Chamber of Commerce of Northern Kentucky, a region hit hard by illegal drug use, that syringe exchange programs, and I'm quoting, reduce not only infectious disease, but also create an opportunity for people to get the care and provide a transition into treatment for people in the community. In the 1990s and early 2000s, 7 evidence-based reviews for federal government agencies reaffirmed that syringe exchanges were effective, safe, and cost-effective. Since then, numerous other studies of programs have replicated these results, including a systematic review by the World Health Organization and another by the United Nations. These included examination of exchange programs outside the United States, in places like Canada and Australia. Syringe exchanges are endorsed by the 2015 National HIV/AIDS Strategy for the United States and the 2012 President's Emergency Plan for AIDS Relief Blueprint. And the American Medical Association also says they work. With all this evidence and the official endorsements, you'd think the government would generously fund syringe exchanges. But as the first program opened in 1988, Congress prohibited federal funding for any such program. With the exception of a few years, that moratorium held until this year. Though federal funds may now be used to support syringe exchanges, they still may not be used to buy injection equipment. Although most states and local governments limit or prohibit syringe exchange programs, some restrictions have been lifted, offering additional opportunities to study the effects. For example, in 2008, the District of Columbia's syringe exchange funding ban was lifted, and several programs began offering harm reduction and exchange services. One study found that the funding ban's lift was associated with a 70% drop in new HIV cases tied to injection drug use. Sean Allen, an infectious disease and public health researcher at Johns Hopkins University and a co-author of the study, wrote, and I'm quoting, "Policies that limit syringe access are not in the best interest of public health. Syringe services programs can prevent new HIV infections, but they need to be accessible to work. Today, injection drug use, notably of heroin, is on the rise and has led to outbreaks of HIV in some communities. In response, some leaders, like Governor Mike Pence of Indiana, the Republican vice presidential nominee, and our local governor, have reversed course and embraced the program. Today, only about 200 syringe exchange programs are operating in 33 states. In many areas where they could do a lot of good, resistance to them remains strong."
Healthcare Triage is supported in part by viewers like you through patreon.com, a voluntary subscription service that allows you to support the show through your monthly donation. We'd like to thank our research associates Joe Sevitz and Karen Green, and our Surgeon Admiral, Sam. Thanks, Joe and Karen. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.